Taryn is Dr. Gianduzo's specialist prostate cancer nurse. When patients first arrive, Taryn checks their health history.
I also do a lot of education for patients before surgery and do a lot of follow-up afterwards as well. I'm here to answer any questions that people may have. Once you're booked up for surgery, we'll run through and make sure if you're taking any herbal medication like glucosamine or fish oil. Leading up to it, we get you to have a stress echo in order to make sure you're fit for surgery, and also some baseline blood tests and urine samples. Just before surgery, the day before, we get you to do some bowel prep. It's a couple of sachets you mix up in water. You drink them, follow it with plenty of fluid, and the only diet you can have after you've started the bowel prep is liquids such as soup, tea, coffee, things like that. The aim is to clear out your bowel in order to create space in the abdomen for surgery, and you continue on your fluid diet until about 6 hours before surgery, when you need to have nothing by mouth.
After the surgery, patients will wake up in the recovery unit before being transferred to the hospital ward, generally with 6 small wounds in their stomach.
They're actually covered in a skin glue, and it's sort of a hard, clear substance on the skin that gradually washes off after about a week or so. When you wake up, you'll have things like oxygen. It could be a mask, it could be nasal prongs. You'll have a drip in your arm giving you fluids. You'll have a drain in your tummy, which drains any excess fluid from the procedure. You'll have the catheter, which will be staying in for a week. And you'll also have some stockings on your legs and some pumps for helping with blood circulation and minimising your risk of a blood clot.
Patients are encouraged to get out of bed and start moving as early as possible to help blood circulation. Initially, a nurse will help with the catheter.
You have the catheter for about 7 to 10 days, so you do go home looking after a catheter. While you have the catheter in place, it's important to drink plenty of fluids, about 2 litres of water a day, in order to keep it functioning well. This is a catheter. A balloon is inflated in order to keep the catheter in place in the bladder. It's connected to a leg bag, which has 2 Velcro straps to keep attached to your leg. It's important to remember that a catheter is drained by gravity. This leg bag stays on your leg for approximately 1 week. It's important to clean around where the catheter exits the penis twice a day with warm water. Always tell your doctor if you have any blood clots in your urine, the catheter isn't draining, any fevers, or any significant pain. So that you can get a good night's sleep, the leg bag is attached to an overnight bag that holds approximately 2 litres. This acts as an extension.
After 7 to 10 days, patients return to hospital to check whether the catheter can be removed.
We do what's called a cystogram, where some dye is put up through the catheter to ensure that the joint is healed from surgery. And when that's okay, the catheter will be removed, and that's when we start working on continence. You shouldn't drive while you've got the catheter in place. However, after the catheter is removed, you can start driving when you feel safe enough to avoid an accident. In that first couple of weeks, lots of walking is good, lots of mobilisation, as long as there's no big steep hill climbs or things like that. After about 2 to 4 weeks after surgery, you slowly start building yourself up to normal activity until within about 4 to 6 weeks you're back to normal.
Before surgery, patients are advised to see a physiotherapist to strengthen their pelvic floor muscles.
This is important because the pelvic floor helps you control your continence after surgery. The reason why we suggest doing this before surgery is to start off on a good foundation in order to help you try and regain continence after surgery. It's important that you don't do the pelvic floor exercises whilst you have the catheter in place though. The surgical site does need time to heal. However, as soon as the catheter is removed, you go straight back onto your pelvic floor exercise regime.
Most patients will then be prescribed medication to help regain their erections.
Cialis is a tablet that lasts in the system for 36 hours. However, it doesn't cause you to have an erection for 36 hours. It helps encourage blood flow to the penis to give you an erection, a spontaneous erection. If about 8 to 12 weeks after surgery you're not getting an erection hard enough for penetration whilst taking Cialis, we may encourage you to start doing injection therapy. Injection therapy isn't as daunting as you may think. A typical response is, "Oh, that wasn't as bad as I thought." It's a simple process where it's a very small injection that you draw up and administer yourself, and within about 5 to 10 minutes you start to see a response, and you will have a full erection within about 10 to 15 minutes.
Erections help the nerves heal and are vital for long-term recovery.
If within the first few months after surgery you don't get an erection hard enough for penetration or good oxygenated blood flow to the erectile tissue, permanent damage can occur.
Like any cancer, there is a chance prostate cancer can recur. Regular PSA tests are important.
The first year after surgery, this occurs every 3 months. The following 4 years, this is every 6 months. After 5 years, we can then continue to monitor your PSA yearly. If there are any further questions regarding procedures or treatments, patients are always free to contact the rooms.
The information provided in this video is to assist patients and their families to understand the nature of prostate cancer and various options for treatment. The information is of a general nature only. It is important before entering into any treatment to ensure that you have discussed your specific situation, pathology results, clinical presentation, and options for treatment, as well as the pros and cons of the different treatment options with a urologist. This video is not a substitute for such a discussion, and whilst it will help you to understand the condition and the options for treatment, it should not be used as the only or even primary basis for making decisions about treatment. The views expressed by Dr. Gianduzo in the video are his own opinions based on the relevant literature and his experience. Other specialists may offer slightly different opinions. You should always consider seeking a second opinion if unsure about a treatment option.